Joined by Heather Pierce from Blount Memorial. She's sharing 5 tips to prevent diabetes. I didn't know you could do such a thing. By the way, good morning.
Good morning.
Friday.
Happy Friday to you.
Big plans this weekend?
Well, I hope to just get outside. so do something.
Listen, if you're hoping for that, just make it happen. Come on.
We have so many places that are just great. I mean, we just live in a great part of the country.
You know? Yeah, it's gonna be perfect weekend for sure. 5 tips to prevent.
Yes.
So how can you prevent diabetes?
Well, you can. I mean, I think a lot of folks are in that. 1 in 3 adults actually have pre-diabetes. So that's not. It's like slightly high blood sugar. You don't know it's happening, there's no symptoms, and that's scary. So those folks really need if 1 in 3 adults have that, only 80% or about 80% don't even know. So that's, I mean, I think testing is probably a good thing to do.
So
but all of us.
So you can just get a test done and they can tell you.
Yeah,
where you
yeah.
are. Okay.
I mean, just visit the doc. I know sometimes it can be scary, but not. I mean, this is, but you want to find this early on so you can do something about it.
Okay.
You can still do things later on, but it's certainly your shot's better, early on. So the first thing to do, be active. This weekend's a perfect time to start if you're not.
It's tough in East Tennessee, right? The winters are cold and nobody wants to go outside. The summers are too hot unless you're on a boat. Having a good time and eating junk food.
Right. So being active somehow.
Yeah, exactly.
Just something, even if you're, wheelchair bound, there are exercises that folks can do. You just gotta,
just
ask.
Stay moving.
Just ask, what would be the best thing. So, because that lowers blood sugar instantly, You can even do like 5 or 10 minute walks after a meal. I mean, that's actually really good. That's like a medicine.
Is it really?
Yeah.
Okay.
So, it boosts how sensitive your own insulin is. So the insulin insensitivity is part of the problem with diabetes. So it helps that. It's the key to get the blood sugar into the cell so you can use it. So otherwise, it's just hanging out in the bloodstream, doing nothing for you other than damaging your cells or the blood vessels. So we want to get that in the cells so it can be metabolized and used. So, so it also helps us lose weight, and that brings us to number 2. Just a modest amount of weight loss, 7% weight loss can be just as effective as a diabetes medication. So so that can be preventative as far as it'll lower your blood sugar. It lowers our cells are larger when we're overweight, so it shrinks them a little bit, and guess what? The bodies work better. The insulin it shuttles the glucose or the sugar into that cell so it can be used. So
same concept on the lines of like if you're obese and you lose a bunch of weight, you can reverse diabetes, correct?
Yes. Yes.
One of them, right?
Right. I mean, I think it's completely manageable.
Right.
So, but you have to realize, you have to take ownership of it. Hey, this is what I have. I've got to do it. And number 3, find I'm a dietitian. There's a lot of diets out there. There's a lot of fad diets out there. I think some, they're always missing something. So just research what's best for you. Find something that works that you can be consistent with. I'm a fan of a lot of different, diets out there if the person can be consistent.
Consistency is key, right?
Yes, yes.
And I will tell you that I think our insurance through here, and I think some insurances, you can actually go see a dietitian and your insurance will pay for it. Like there's no cost at all. Yeah. So, I mean, check with your insurance company.
Absolutely. Give them a call.
Absolutely, if this is something that you're interested in.
Yeah.
You'll be blown away on what your insurance does actually cover.
Yeah.
Some things maybe not you like, but
right. That's positive, though. It's really good.
Check it out.
And, historically, you have to have a diabetes diagnosis to get coverage, but I think they're getting better at seeing the preventative.
Absolutely.
So that's good. Another thing, when you pick that diet, make sure it has fiber. So number 4 is eat fiber. So it slows down digestion. So it's thought to have a slower effect on how quickly your blood sugar rises. So, and it's still kind of out. We don't know exactly how that concept works, but it does make us feel fuller longer, and it can help with weight loss.
Weight loss, there we go.
Fiber. 25 to 35 grams a day, try to get in that range.
Helps from that 7% that we're looking for.
Yeah, and number 5 being, trying to get that blood sugar tested. So if you're 45 or under and overweight, it's a good time to go see the doctor. And
overweight being what?
BMI. Well, you can go online and look at your body mass index, but really at over 26.5, I believe, is considered overweight. So
26.5.
Yeah, body mass index. But if you're obese, that's 30 and above, and 40 and above would be morbidly obese. So certainly
I know there's like cool machines too, like where you can stand on it. It measures like your body mass, your muscle mass, your bone mass, your body fat, and where it sits.
Yeah.
Right?
Yeah.
I've had it done before, and it's fascanating. And it's really not that expensive to get it done.
Yeah, so I think there's a lot of testing out there you can do. Just a simple blood test.
Absolutely.
Just to see where is that fasting blood sugar, or where is that sugar. Also, if you're over or younger than 45, but overweight and other risk factors like sedentary lifestyle,
you gotta get active.
It's just you just gotta
get active, which means the weather's perfect. Heather, you said you want to get outside.
I'm gonna
better do it.
I will.
Better do it. Heather, thank you so much for
Thank you for having me.
Information this morning. All right.